benign prostate enlargement is a common problem. A typical male in his mid-60s will present with urinary symptoms, difficulty passing urine, going more number of times, passing urine at night, and overall having discomfort. So his quality of life is affected, and that is where the treatment with either medical therapy with tablets, if that fails, the pioneer treatment is Holmium Laser Enucleation of the prostate, which is called a HoLEP. A Holmium Laser Enucleation of the prostate is a procedure which is done keyhole. So through the natural orifices of the body, which is the male urethra, we introduce an instrument into the bladder. We map out the prostate, and then using laser energy, which is delivered through a glass fiber, you go and cut out the prostate. The advantage of laser energy is it delivers heat and energy to cut prostate tissue at the same time. So the prostate is enucleated. After enucleation means large pieces of prostate are placed in the bladder. Then you have a device called a morcellator, which removes prostate tissue into a receiver, and that tissue then can also be analyzed, so that patients having surgery, you not only get the prostate tissue out for analysis to exclude cancer, but also you can analyze the tissue to make sure it is all benign. Once this is done, a patient has a catheter placed in the bladder, which is left for overnight or a maximum 3-day period. And after this, the catheter comes out. Yes, my patients are taught about pelvic floor exercises because they don't want incontinence after the procedure. So all these things put together, Holmium outclasses other forms of treatment today because it has the advantage of no restriction on size, the use of normal saline, which is the normal body fluid. So there's no absorption in the body. There is no need for transfusion. There's very minimal need for analgesia or pain relief. And they require very few antibiotics because they are up and about, and the catheter in their body stays for less than 3 days. The risks associated with the HoLEP are small, but they are: incontinence, less than 1%, infection or bleeding, again, very small. And lastly, the risk of sexual dysfunction, it is less compared to other conditions. So overall, the risk ratio compared to other prostate surgeries is much lower. The beauty of this operation is that it can be done as a day case or a very short stay, 23-hour stay. So the patient comes into hospital, would have had some basic tests. The blood loss in this procedure is minimal. The recovery time is days rather than weeks, and patients almost get back to normal life within 7 to 10 days. The good advantage of Holmium laser surgery is there's minimal bleeding. There is no need for blood transfusion. Patients' prostate size is a big criteria for other types of prostate surgeries, but with Holmium laser, a prostate which can be measured in grams, anything over 60 grams or 80 grams is regarded difficult surgery, whereas with Holmium laser, I have done patients up to 500 grams. So that's the advantage with people having very large prostates, can still have the treatment and get back to normal life very quickly. The other good advantage of Holmium laser is the recovery time for patients. They can get back into productive life. They can get back on their feet. I have seen some patients who've had surgery and within 2 weeks are on the golf course, getting back their normal life.